Hi, it's Brian Davis from Home Helpers, reaching out to our clients and their family members to check in this time of great uncertainty with COVID-19, the coronavirus. Wanted to assure you of a few things. Number one, we plan for things like this. We plan for emergencies. We plan for contingencies. We have great support from our Home Helpers corporate office in Cincinnati, the Home Care Association of America. We've got a great experienced team of office staff and caregivers here, led by Michelle Pantoya, our care director, who has many years of experience. I have 18 plus years of experience in healthcare. I worked at a hospital system. I went through H1N1 and SARS. This is obviously much bigger than both of those, but the same principles apply on how do you approach things. We're doing three different things. First and foremost, we're communicating frequently. For the past few weeks, we've been proactively communicating with our caregivers about COVID-19, about what to look for, about how to protect you, our clients and families, and how to protect themselves. So communications is so critical. We've been texting, we've been sending videos, we've been sending reminders about hand washing and exactly how to do that. So you can be assured there's tons of communication on a daily basis with our caregivers on this. Secondly is training. Our caregivers are already trained to protect our clients. They're already trained how to take precautions for any virus or bacterial infection. That's what they've been trained on in the past. This is just ratcheted up one more level to make sure that they're taking every precaution. So communications, training, and lastly is execution. And that means stressing to our caregivers to do the right thing. Number one, social distancing. It is so important. It's kind of a new term for a lot of us. We're learning along the way, but stay away from crowds, isolate yourself as much as possible, and make sure that you are focused on doing your job and protecting the older adults who you serve. And as part of that, executing properly is washing your hands properly, which I already mentioned. I know all of you are probably very focused on that as well. Disinfecting the client's home. You probably noticed a huge uptick in that. Hopefully you can keep those supplies coming for our caregivers so they can disinfect your home. Also, our caregivers are really adept at noticing changes in condition and reporting those immediately. They've been trained on that. We have a button right on the ClearCare app that they clock in and out of and do their tasks on to notice change in conditions, and they know to report those change in conditions to the office, and we can report them automatically to you. So that's a really nice tool that we have. It's an advantage of having an experienced home care agency like us. I would encourage you and your family to limit visits to the older adults in your family. You probably are already doing that. Your safety and the safety of our caregivers is paramount for myself and our team. We want you to be safe. Our caregivers are focused on safety. We're going to stay in really close communication with our caregivers, again, on a daily basis. If you have any questions, if you have any concerns, please reach out to us. I can't tell you how much we appreciate your trust. It's a real privilege to serve you, especially during a time when older adults need us the most in a time like this. Our office staff is up and running. We are doing social distancing. There's a few of us in the office spread out far apart. Other people are working from home, but they can pick up the phone on the app right away. So when you're calling in, you'll be talking to everybody. We're fully functioning. Again, thanks for listening. Don't hesitate to reach out to the office if you should need anything or have any questions or concerns. Thanks again.